An intensive care nurse who came from the U.S. and has been volunteering at Nasser Hospital in Khan Younis in southern Gaza has been documenting what she witnesses on social media. Elidalis Burgos, that's her name, recently posted a video with a child who lost his entire family. Let's have a listen.
As long as I'm alive and have breath, I won't stop fighting for you and fighting for the people of Gaza. Because this is just not human. This is not right. And so I will fight for you for as long as I have a breath.
Elidalis Burgos joins us live now from Nasser Hospital. Eli, you volunteer there with the medical organization GLIA. You work in the intensive care unit. That means you've treated many patients who've been brought in after mass casualty events. Now, in the video we just saw, you were talking to Mohammed Abu Asi. He's about 10 years old. How's he doing now?
To be honest with you, he's probably not doing well, but I haven't been to that ICU again in a couple of days. I feel that right now there's 6 other makeshift ICUs in this hospital. So I rotate through the ICUs and the emergency department as well. But the fact that there's very little to no nutrition, he's not going to do well in general. I anticipate that he will die from secondary complications.
Now, the social media post that we're watching, we can't see the text, but it did say that he has no family left. Were you able to find out what happened to them?
It was a bombing. And so his whole family passed away, and he was the only survivor. Being a child and surviving family, it's a new, medical acronym that is used only here in Gaza because it happens so frequently. And so he is unfortunately one of those children with no surviving family and devastating wounds.
We said he's 10 years old. Who's going to care for him? I mean, of course, hopefully, we're all rooting for him to be saved, cured, leave the hospital on his own 2 feet. If that happens, who's going to be there for him?
I think normally they try to reach out to extended family as much as possible, but the whole population here in Gaza is under starvation. So regardless of who he goes with, the situation won't be any different, whether he was with extended family or his own family. Starvation is being enforced into the entire population here.
Another video that you posted that got quite a lot of attention online is your appeal to the U.S. Special Envoy Steve Witkoff to come and see Gaza for himself. Now, the Israeli military just today gave him a tour of Gaza. That was this morning. We were talking about it earlier. If you had got to give him a tour, the Eli tour, what would you show him?
Well, first, I would have him not go to a pre-planned area that the Israeli military is taking him to. I would have him come here, come into Nasser, walk the halls with me. I can take you to any hallway, any of the units, emergency department, and you will see the entire population who's obvious, visible evidence of starvation, and you don't have to be a medical provider to see that. And also I will show him that every injury that's in the hospital is either a gunshot wound or an explosive injury. We don't have chronic conditions here because chronic conditions, quite honestly, they don't fit in the hospital. The hospital is over capacity, to say the least. And so every person that is here is basically a trauma case. And the majority of everybody I've seen has been injured, either sleeping in their tents, being bombed, or shot while at these distribution sites. So every patient here is a trauma patient with no nutrition, which anybody who knows anything about, even the basic level of how a human body works, if you don't have nutrition, your body's not going to heal. So if they're fortunate enough to survive the trauma, they will die from malnutrition, and we've seen it. We watch them die right in front of our eyes just because they deteriorate after the injuries, despite having maybe a surgery that could have otherwise saved them. They die from the malnutrition that comes after.
Since we're talking about seeing things with one's own eyes and understanding what's really happening, the U.S. ambassador to Israel was with Witkoff to see the GHF's operation specifically, and he described in his tweet, we're seeing the picture he posted there, he described what they do as, quote, an incredible feat. Meanwhile, of course, on that very picture, you see crowds of Palestinians waiting behind razor wire, presumably waiting for food. He spent maybe max a few hours in Gaza. You've been there for a month, at least a month. Have you seen Americans, Israelis, or the GHF for that matter, perform an incredible feat of feeding Palestinians?
They've performed an incredible feat at killing Palestinians, and that is without a doubt. So every single time that there's an 8-site setup, we can basically time it like clockwork, and we will start getting the mass casualties into the emergency departments every single time. And so how is it an incredible feat when you only have 4 distribution sites for a population of 2.2 million people, when the system that was in place before that had 400 sites in order to distribute food and aid to the population in a dignified human way? The way that is being run right now, even if they pretend to have good intentions, it is illogical to believe that 4 distribution sites could practically, in a very practical sense, deliver aid to more than 2 million people who are starving, no less. And so they're desperate for food. And so the little bit that trickles in is nowhere near enough for what is needed for the population here. And the level of starvation we're seeing physically in the patients and people just, the displaced people all around the hospital doesn't happen overnight. This is months and months in the making of this forced starvation due to the blockade.
And you know what you're telling us now, there have been other doctors and nurses and health practitioners who've come to Gaza and have done everything they could, like you are doing now, to tell people what's really happening on the ground. And the reality is that their warnings have gone unheard, or at least they haven't changed much on the ground. In fact, the facts on the ground have got worse. How do you grapple with that reality?
I mean, it's tough, I came here to stand in solidarity and to help it because I have a skill. Not everybody has a skill to be able to come here. It is very difficult to come here. We also try to help by bringing in the little bit that we can in our one suitcase that's allowed. But the Israeli military throws away baby formula that the doctors and nurses try to bring in. And it's very frustrating that the world is not listening. The world is not listening to Palestinians who are documenting their own genocide, but they're also not listening to the internationals that are coming here and ringing the alarm, pleading with the world to open their eyes and see what's happening, what is being funded with our government or by our government with our tax dollars. And it's really disheartening to think that, we as humanity are here in this time in 2025 witnessing a genocide on 4K on our phones, and people just refuse to believe the only ones who are on the ground eyewitnessing this, which are the medical providers who are allowed to come in. We've been ringing the alarm for 22 months and nobody seems to be paying enough attention. The world leaders seem to be in denial. And so that's why I urge them to come here where we are, where the medical staff has been, and let us show you around. And you may have a different view after walking with us for a bit.
Elidalis Burgos, intensive care nurse, currently volunteering at Nasser Hospital inside the Gaza Strip. Thank you for your time.
Thank you so much for having me.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.